Welcome back to Medical Monday. Getting lots of questions answered today about colorectal cancer. Dr. Susan Briley here, practices out of St. Thomas Midtown. If you want to look her up, we'll also be giving you the number to call at the end of the show, so have that pen and paper ready. We will give that number to you very shortly. As we get any calls lined up that you might have at home, go ahead and give a call now because our phone lines are open. Let's talk about the old colostomies. And people remember, maybe a grandparent had a bag, and that can be kind of fearful. No one wants to live like that.
And I think that's behind many people's fear of having a colonoscopy. If they're diagnosed with colon cancer, 50% of the people I see say, do I have to have a bag? Do I have to have a colostomy? And most of the time the answer is no. There are a few patients who have rectal cancers in a very low location or it's very advanced. That's a whole nother discussion, but occasionally it is required and occasionally it is permanent. Probably more frequently we see patients who have a cancer that needs to be treated with multimodality therapy, chemotherapy, radiation, surgery, and those patients may need a temporary ostomy, and when they're done with their therapy, then we can reverse it. So that should not be a reason not to get screened because it's really very uncommon. But for the patients out there who are going to have ostomies or who already do, the appliances we have these days with the adhesives and the plastics are really mighty fine.
Really? Well, that's changed.
Yeah, it's not like it used to be.
Okay. That is some good news.
It's a very livable situation. And there may be physicians out there. There is a pro football player who had a stoma. He was a place kicker. Dentists, nurses, professional golfers. And there's a rap singer too. I've got a picture of him somewhere.
So completely normal people living with this and doing just fine.
Yes.
Into that story. Okay, let's jump back to the lines. We have Jan on the line. Jan, thanks for being part of the show. What's your question tonight?
I want to know if you got colon cancer and you go with it untreated, how long you can live with it, and then all of a sudden you got diarrhea 3 or 4 times a day.
That's a very difficult question to answer. I guess my question is, why would you want to go untreated, or why would you not get treatment? Because eventually it is going to be fatal. That's a very serious situation. Every cancer is different, and some are very fast growing and aggressive, and some are very indolent and slow growing, but you don't know that unless you don't treat it.
And your word of warning always, get the screening before you would ever have cancer.
Right.
Get ahead of it, right?
And if you do have symptoms, have a diagnostic exam.
Okay. When the normal screening, if you're not at risk, if have it at 50, wait another 10 years if all went well, does that indicate that that colon cancer is typically a slow progressing cancer, or should I not read it like that?
No, because every tumor is different. Some are very aggressive and rapidly growing. We tend to think that from polyp to cancer is just a few years, but that's very unpredictable. I've seen people who said, well, I had my screening 4 years ago and now they have an advanced cancer, but they had symptoms
in the meantime,
didn't get it checked out.
Right. So even if you've had that screening even a year ago or so, and then all these symptoms pop up, it's time to go speak to a doctor.
Yes.
We haven't talked much about rectal cancer this evening. What can you tell me about that? What do people need to be aware of?
Same symptoms, but there may be more of a sense of pressure with a rectal cancer, and it's a symptom where the patient feels they need to go, but they're not successful and they still have this feeling of fullness. That's a late sign. But again, rectal bleeding, and that's a pretty easy test that I described before in the office, a rectal exam. And make sure your doctor does it.
Yeah. Now, when men get their prostate exam, hopefully on a yearly basis or whatever that's called for, I don't know the exact requirements, would that kind of cover that too? Or
it should.
Okay.
I've seen
You
it.
said that
I've
with some
seen it
hesitance.
missed.
Okay.
I've seen, patients who had their prostate examined. It's on one side, and they got to go
You
all the
gotta
way
go
around.
Gotcha.
I know. I hate to be graphic, but
It's
that's
the
what I
things
do.
that we should know. We have to know these things about our body. If no one tells us, I didn't go to
Yeah.
medical school.
And patients on whom I do a rectal exam say, well, did you feel my prostate? And I say, yes.
Yeah.
And if I skipped over that, then I say, nope, I have to go back and do that if you
Want that
want
done.
me to check that today.
Okay, very good. Let's hop back to the lines. Darlene is waiting for us. Darlene, what's your question?
Yes, I just have a question. Like each time I go to the bathroom, like if I have a bowel movement, and I would wipe and I would see a little blood. It was very light, nothing really heavy, but it went on for like 2 weeks, and sometimes I still see it from time to time. And I have made an appointment for, colonoscopy, and I had a rectal exam, and everything came out, clear, and a pap smear, and everything was normal. But I was still a little, worried about that.
Anything else that she should be concerned about?
Well, if there's ongoing rectal bleeding, it could be hemorrhoids, it could be an anal fissure, it could be anal skin tags, but that's where a good examination by either your primary physician or colorectal surgeon or gastroenterologist should be able to help. And, I see people who've had a normal colonoscopy, I look, I don't find anything, and I say, look, when you have this bleeding again, call and let's get you in, let me examine you. Because there could be subtle tears that can cause a little bit of bleeding.
Would you do
but you
anything
just
for
have to
that?
look-
Is it just to heal on your own?
Put the patient on psyllium fiber, as
Okay.
I've mentioned before, and just kind of see what happens. And you have to kind of keep pushing and going back, because honestly, we kind of feel and maybe get fooled if the patient didn't come back, they must be better.
Right.
And so that's our assumption, and that may or may not be true.
Should everybody be taking the psyllium fiber? Because you've mentioned it several times, so I want to know.
I don't have stock in it.
No, I'm not saying it for that, but if it's something that we should take as a preventative, it's something that's just good for our body, I want to know about it.
Well,
What's your
it
thought?
doesn't hurt.
Yeah. And just can help the system stay healthy?
Yeah.
Yeah. Okay, so there you go. Little health news for you tonight. A lot of health news
But
for you
then I'll
tonight.
have fewer patients to see.
Well, that's okay too
hemorrhoids.
sometimes. Yeah, that's true. That's true. What, as people come into your office just for a regular exam, what should they expect?
We talked about the history and then the physical, feeling the abdomen for masses and, heart and lungs if it's indicated for a more serious problem. And then I have patients lay on their left side. I have a light and I look around and then I do the rectal exam.
And this all takes about how long?
I'm pretty fast once I get in there. The exam takes just a few minutes.
Wow.
Or very few minutes.
Okay. I think, as I go to the doctor, I like to know what's coming. So I think if people know ahead of time, it may ease some anxiety, right? I mean,
Yeah.
I'm sure you've experienced that.
And a lot of people think I'm going to put them up in stirrups, like
Right.
the gynecologist. Men assume some very interesting positions.
I'm sure.
But I just put the patient on their left side and
These are all good things to know. These are all good things to know. Let's talk a little bit about the big C word, cancer, and let's just, if someone is diagnosed with cancer thanks to a colonoscopy, what can they expect next? Are we talking the whole thing of chemo, radiation? Is that a given, or does it depend on the stage?
it depends on the stage. We talked about the CT scan and the chest x-ray and the lab work, do the surgery. Cancers are staged 1, 2, 3, 4. Stage 1 colon cancer means that it's just on the inside lining. Stage 2 means it's going into the wall. Stage 3 means it's into the lymph nodes. And stage 4 means it's gone other places.
And when you hit stage 4, what are your chances, I guess? Everyone wants to know.
That has changed so much over the past few years. I have a few patients who have had stage 4 disease for several years. And if you had asked me that the first time I was on the show, I would say that it's completely incurable. You have 2 years to live. And that is not true anymore because of the chemotherapy agents. But that's a whole discussion for the oncologist because stage 4 is not good, and it's not usually curable, but it is treatable. Stage 3 colon cancer, we do recommend chemotherapy. Stage 2, it depends on the type of tumor it is. And stage 1 is almost always cured, not always, but usually cured by surgery alone.
Okay, good to know. We're going to take another quick break. This is when I need you to get that pen and paper ready. We're going to have the way that you can contact Dr. Briley if you have questions, want to get an appointment. We'll have that right after the break, so stay with us.